Hello and welcome to Peel Halton Local Employment Planning Council's webinar on mental health and accommodation in the workplace. My name is Shalini Dacuna, Executive Director for the Peel Halton Local Employment Planning Council, and I will be your moderator for today's webinar. Before we get started, a few things to note. We really want to hear from you, and we want to ensure that your questions are answered. So be sure to use the question and answer panel on the right side of your GoToWebinar and post your questions there. I will answer all questions as we go along. Please ensure that your screen is expanded to maximum mode. Okay, we are ready to begin now. I'd like to introduce our featured presenter, Canadian Mental Health Association Peel educator, Tammy Whalen. Tammy has been no stranger. At the tender age of 25, she faced a difficult battle with cancer and experienced the anguish of losing loved ones to drugs. After completing her diploma in fundraising and volunteer management, Tammy went on to raise over $350,000 for the Toronto Sunnybrook Regional Cancer Centre through the Road to Recovery Gala. Today, in her role as educator, Tammy is focusing her efforts on helping to spread the word about mental health that affects so many Canadians in all walks of life and is determined to fight mental illness and overcome the stigma surrounding it. Tammy believes that it is through understanding and acceptance that we can build a network of support for those in need. So without further ado, to Tammy.
Good morning, everyone. Shalini, I'm just going to ask that you unmute me.
Okay.
Can you hear me now?
Yes, we can hear you, Tammy.
Okay, I'm on. So welcome everyone. Happy, I believe it's Wednesday morning, 10 a.m. It is a pleasure to be with you this morning. We're going to be talking about mental health and workplace accommodation. Shalini will be taking questions closer to the end of the workshop. You have about an hour with me, and I'm sure there are going to be a number of questions which we can answer, I'm sure some of them today, but we can also follow up with you with an email or phone call conversation after this workshop. So like Shalini mentioned, my name's Tammy. I work with the Canadian Mental Health Association. I specifically work for the Peel Dufferin branch. If you're not aware about the Canadian Mental Health Association, we are a national organization. We're across Canada, and we support individuals living with mental health issues. We are a not-for-profit agency. All of our services and programs are free of charge. We are different than CAMH. A lot of people make the mistake because we have the same letters. CAMH, just for the record, is the hospital in Toronto. CMHA, like I mentioned, is national, and we're a community-based organization. So when you have a chance, please visit our website at cmha.ca. I'll also give you my information at the end of the workshop, and if you would like to reach out in regards to other trainings, services, referrals for your employees, for yourself, please do so. All right, so I'm going to move this over to the right. I can't see this screen. All right, so we're going to start off with some basic stats for us to think about while we move through this workshop. So the first one here is, on any given week, more than 500,000 Canadians miss work because of mental illness. Now, when we look at that stat and we think of a small town like perhaps Brampton or Hamilton, which has approximately between 500 and 700,000 Canadians living in those towns. Imagine if that entire town stayed home from work on the same day, and imagine the impact that would have on its community. Buses, groceries, schools, libraries, everything would be closed and we wouldn't be able to do anything. Now, when we're also thinking about this stat, 500,000 Canadians miss work on any given week, we are talking about perhaps a sick day, short-term or long-term disability. Having said that, 30% of the disability claims are due to mental health issues, and 70% of that 30%, those costs are attributed to mental illness. 1 in 10 get effective treatment. And what I mean by that is effective treatment, meaning that the person or the individual feels like they are better, they are feeling better, they feel like they can move forward. When we're looking at payroll costs, the average company experiences 12% of payroll costs attributed to lost productivity and sick leave. So when we're looking at the cost of a disability leave for a mental illness, it's about double the cost of a leave due to physical illness. So this is something to remember. Individuals with a mental illness are much less likely to be employed. And also something to consider is that unemployment rates can be as high as 70 to 90% for people with the most severe mental illnesses. So let's keep that in mind as we move forward. Some more information here, and this is very important for individuals who are working in HR as a manager, as a supervisor, basically anyone who is supporting individuals in the workplace. Only 23% of employees would talk to their employer about their mental illness, and that's something to think about. When we talk about why the reasoning behind this would be, I think about things like fear of losing their job, or individuals or their manager's perception on how their job is being done. Also, we talk about stigma and that fear that comes behind a diagnosis with mental illness. When we look at our managers, 1 in 3, 1/3 of managers feel equipped to address mental health issues in the workplace. So that also speaks volumes. Only one in 3 managers reported having training. However, a stat is telling us that about 55% of managers or supervisors have intervened, meaning they have helped someone, they've had a conversation because they did recognize signs that someone perhaps is struggling. So some things that we would like to strive for in our workplace is that early identification and effective treatment. Now, when I use the word treatment, one thing I want us to remember is that treatment is very different for each person. Treatment doesn't always mean medication. It can for some. Not everyone requires medication. But when I use the term treatment, I am looking at it from a recovery lens, meaning treatment could look like exercise, diet, time off, working their regular hours and not doing overtime, making sure they take their lunch, making sure they have someone to check in with, checking in on someone's workload. Treatment looks different for every person, and we need to remember that. So when we are identifying things early and helping someone out earlier on, what you will start to notice is that decrease in disability time, that decrease in treatment time, that decrease of severity of symptoms, and also the illness duration. It also improves the probability of return to high levels of productivity. When our employees feel supported, they will work harder for us. We also want to remember that when we are helping people out and when we are identifying early, we are building that connection with our employees. We want to remember that our employees are human beings. And that is a key message to remember throughout this presentation. So we are going to talk about some of the various legal considerations that impact accommodation. So accommodation is essentially helping your employee out. So we'll take a look at what accommodation looks like. But before we take a look at actual accommodation, we also just want to take a look at some of the workplace acts to keep in mind. So we're looking at privacy, because this can also be an issue, and also your employees' human rights. So we'll take a look at these things. So the first bill I have listed here is Bill 168. This is the Workplace Violence and Harassment Act. It's required to maintain a safe workplace, and it essentially is recognized workplace violence and harassment as contributing to poisoned work environment. So essentially, if someone feels that they are being harassed in the workplace, then they can go to HR. And HR has that duty to investigate. So the role is to educate, monitor, and report. I'll move on to the Workers' Compensation Act. This is an administrative act. It relates to the payment for workers' compensation benefits. So it's historically recognized for mental health issues arising from events that I have listed here. Typically, not mental health issues that perhaps arise in the workplace. And something that we need to be aware of is that sometimes people's mental health is not doing well because of the workplace. Perhaps the workplace is a toxic environment. Perhaps the employee is struggling with their workload. The assumption sometimes is that their mental health issues are arising from outside factors and the outside factors are coming in, but it can actually be the other way around. So with this act, what they look at is events that are resulting in acute emotional responses. They're caused by sudden and unexpected traumatic events, and events that arise out of and in the course of employment. When we're looking at Bill 127, benefits for the employee may be granted for harassment, humiliation by supervisors or managers, excessive workload, and wrongful accusations of wrongdoing. Some cases have gone through tribunals after multiple appeals. Decisions have been made in these cases where the decision to deny benefits were considered unconstitutional and benefit payments were upheld. So these are some things to consider as well. When we're taking a look at our Human Rights Code and we're talking about human resources, they have similar obligations that exist provincially, territorially, and in the federal human rights codes, including the Charter of Rights and Freedoms. So essentially what we're looking for, what we're noticing in the Human Rights Code is that everyone has the right to equal treatment in employment and cannot be discriminated against on the basis of actual or perceived disability. Also, the obligation to take steps to eliminate different and negative treatments on prohibited grounds. Furthermore, when we're looking at the Human Rights Code, there is that duty to accommodate. So this applies to employees and public served. Essentially, if our accommodation could be something very simple. So accommodation could be something like changing somebody's hours, if they can, depending on obviously the job. It could be making sure the employee is getting their lunches, getting their breaks. It could be taking X amount of days off in a month. However, sometimes accommodation has limits defined under undue hardship. So undue hardship can be claimed when adjustments to a policy, practice, bylaw, or building would cost too much or create risks to health or safety. So essentially, sometimes the accommodation can cost the organization X amount of dollars, and with this, they would consider that an undue hardship. No precise legal definition is applied here. Each circumstance is evaluated on its own merits. So when we're looking at accommodation, accommodation for each person is going to look very different. And when we're talking about undue hardship from the employer standpoint, it really does depend on what the accommodation looks like. Sometimes the organization cannot accommodate, so they have to look at other options. And sometimes this can lead to legal cases, right? So that duty to accommodate. Jurisdictions across Canada adding obligations to accommodate mental illness in the workplace. So yes, the employer has a duty to accommodate. The employer also has a duty to inquire. So I have in brackets ought to have known. If, for example, you are working with someone and you do notice a change in their behavior, you do notice that perhaps they are struggling, as an employer, you do have a duty to inquire. So this requires the employer to inquire and provide accommodation about a situation where the employer is aware or reasonably ought to be aware that a disability is negatively affecting the employee's work performance. So essentially, if you know something is happening, or if you have a feeling that something is happening, let the person know that you do recognize that they aren't feeling so well, or you recognize ABC in their performance and you'd like to have a conversation. And essentially what we want to remember is that instead of, or I should say oftentimes, before this whole duty to inquire or the accommodation piece happens, sometimes people are reprimanded for their behavior or for things falling through the cracks. Perhaps the hope is before that even starts or begins, we want to be able to inquire and accommodate. So some things that we want to think of, putting all of those legal bills to the side, is when we are supporting someone that perhaps is struggling with their mental health, we want to ask ourselves, if I were personally struggling at work, how would I want my manager to treat me? And we really need to remember this. Being a manager, supervisor, being in HR, it is a difficult job because we all have work to do. And I can appreciate that. But in the same token, we need to remember that we need to treat humans with care, right? Oftentimes, and I know things are changing, thankfully, but there is a stigma associated to mental illness. Oftentimes when we talk about mental illness, there is a negative connotation with it. We talk about mental illness in negative terms. And this is why many people do not reach out and get the help that they need. So if you can imagine someone trying to get their job done, but is struggling because they're not mentally well. Not everyone that has mental health issues has an illness per se. An illness typically is diagnosable. Having said that, as a manager, supervisor, even as a friend of a coworker, there is nothing wrong with checking in with someone to see how they're feeling, how they're doing, and how you can help. Another thing to think about is, if you were off work, how would you want your manager to communicate with me? So sometimes when people are off, people want their space, where other individuals might want you to check in with them. I would say for this one, sometimes with organizations, it's a pretty blanket statement, or it's pretty straightforward. Someone goes on leave, whether it's for cancer, whether it's for time off with a loved one, whether it's for mental health issues, and the same thing is done for each person. I think something to look at or communicate with your employees is what they'd like to see happen during their time off. So, you know what, Joe, if you're off for 6 weeks, we're going to be here to support you. Would you like me to check in with you? Is it okay if I check in with you? If I do check in with you, do you want me to email you or would you appreciate a call? These sorts of things are something to consider. They're small things, but they mean big things and they go a long way. Something also to consider is people returning to work after a sick leave, no matter whether it's for a mental illness or any other medical illness. Find out what would be helpful. And I will give you an example. There is an employee in my workplace who lost a loved one, and they were off work for a few months. And before they came back to work, their manager checked in with them to ask about the communication, to ask about how they can be supportive, to ask about what they need for their first day, their first week, their first month of work. And essentially, the employee gave a list of things to do and not to do. Okay, so in a nutshell, an email was sent out to the staff to say, so-and-so is returning to work on Monday. We all know that they lost a loved one. They have asked that no one ask about the loved one. Have a regular conversation. They are back to work. They're ready to work, and they want to leave the conversation there. This is a perfect example of checking in with your employee and making them feel comfortable when they return back to work. We also have to remember that our employees are human beings and that our employees are very different. So checking in is something super important. Some things we can also consider when we are accommodating someone. First one there is, stopping and considering the situation. So keeping an open mind. What you know is one side, right? So step back from assumptions, judging, and labeling. Oftentimes, again, when we talk about illness, mental health issues, we are quick as human beings to make assumptions. We are quick to label people, put people in boxes. And we need to take a step back away from these assumptions and from labeling individuals. And we need to remember the person behind those mental health struggles. We also need to remember that we may too also struggle at some point in our lifetime. So when we are stopping and considering the situation that's going on, we definitely, as a manager or a supervisor, want to observe and identify changes. When we talk about what a mental illness is, it's a change in behavior that is consistent and it's affecting an individual's day-to-day life. So if someone is struggling, you will notice, or you may notice, some changes in their behavior. You may notice changes in performance. So performance could look like not staying on top of emails, not returning phone calls, not meeting deadlines, not showing up to work on time, and also relationship changes. Does this individual have relationships in the office? And if they do, are those relationships changing? How is this person communicating with others in the workplace? Also remember, the next point there is to consider the context. What you know is going on. So the person may share, the person may not. You can only do what you can do with the information that you have. So again, I'm going to go back to assumptions, asking questions instead of making assumptions, asking the person how you can help would definitely help the person or the employee. Also consider what you don't know, right? We want to consider factual information that you can share with the person. And also is it going into a situation without a clear outcome in the mind, right? So remembering that as well. So let's assume you do recognize some changes in your employee and you want to have that conversation. I'm going to suggest that you prepare for the conversation. So we want to set a meeting in time, place. We want to demonstrate the need for respect and also the need for privacy, right? Perfect example, I worked at a place where the HR office was smack dab in the middle of a very busy area. And when this HR person met with individuals, door was always open. This to me does not maintain privacy because the person who is coming to see the HR individual is trying to have a conversation with a door that's open where people are walking by, etc. So things like closing a door, or perhaps meeting at a coffee place that's close by, or setting up a walking meeting where you can walk around the building perhaps and walk and talk at the same time. Something also to consider is not delaying or ignoring. Oftentimes with many issues in our life, we avoid or ignore or delay. We sweep things under the carpet. We hope things are going to get better. In fact, the opposite is true. So if we are recognizing changes in behavior, we're recognizing changes in somebody's performance, do a check-in. Maybe you're doing a quick check-in first. Just checking in. How are you? How's life? And if you continue, or if they share, or if they want to speak, then you can set up that more formal opportunity to talk. Something that's very important here are setting aside time. The worst thing that you can do is to make an appointment with an employee and then also be doing other things. This often happens. You meet with someone, they're meeting with you, you're hoping that they're going to give you their undivided attention, but then they have other emails or phone calls coming in. Maybe their phone is distracting them. And you know what? When that is happening, you're technically not setting aside time for that individual. We want to keep mindful of the time. So what I mean by that is if you are setting up a meeting with an employee, give them the time. We're going to meet from 9:30 to 10 and be loyal to that time. If it goes over or if it goes before, you can talk about that through the meeting. We also, keeping that in mind, we want to assign enough time to talk through the issues and work towards an action plan. And having said that, we need to recognize that it may take more than one meeting. So when you are meeting with an individual and perhaps the conversation is making you uncomfortable, it can be challenging to talk about what someone else is going through, their challenges, whether it's in the workplace or not. It's not an easy conversation, but again, we want to talk about maintaining and building trust with that employee. That employee wants to know that you're there for them. That employee wants to know that you're actually hearing what they say. Most people, I'll tell you right now, listen with the intent to they listen with the intent to respond. What we want to do is to listen with the intent to respond, to understand, not respond. So hear what they're saying. So in order to do that, we're hoping to gain an understanding of the person's issues and perspective, share the concern for the person. Maybe you're letting them know that I'm checking in with you because I care about you, or I'm checking in with you because I've noticed A, B, and C. So I thought I would check in to see how you're doing. Also, letting the person know that they're a human being, right? And what I mean by that is it's okay to cry. It's okay to feel this way. No, you are not weak because you're experiencing these situations. Again, if I go back to stigma and judgment, oftentimes people feel judged, people don't want to be labeled, and that is why they don't share. So giving them that opportunity, that stage to say, I'm not feeling well and this is why, and not offering advice or resources right from the get-go is actually going to help you having this conversation. So when we're looking at framing the conversation, I've given you a few tips here that you could start the conversation with. Again, this conversation can be informal or formal. So some of the things I've written down here is I've noticed. So I've noticed you've been coming into work late for the past, let's say, month, and I just thought I'd check in. Is everything okay, right? It could be something very simple where the person needs to start a half an hour later, depending on the job. Now, I want you to know that I appreciate that everyone's role is very different. Some people have to be at their role, at their job, at their desk, at their machine at a certain time. So we have to think creatively. I'm concerned, I'm wondering, and also just reminding the person or asking the person how you can help without making assumptions. Because like I mentioned before, we're really good at making assumptions. So like I said, we want to listen to understand. We want to give the person some time and space to reflect on the questions that we're asking, also reflect on what they want to say, what they want to share. And also, the next thing here is reframe the information received. So what I mean by that is paraphrasing. Maybe you're taking notes, validating how they're feeling, validating what you're noticing, and validating your understanding. So I am hearing that you are feeling sad or angry or frustrated or overwhelmed because of, right? That would be validating, and just checking in with the person to see if you're on the right page. Again, asking how you can help. We want to think about immediate safety concerns. So if they're dealing with machinery or equipment, that's something to think about. If their behavior is causing you concern, perhaps they share with you that they're having thoughts of suicide. Immediate safety concerns. We need to address that. And I'll talk about that in a second. Resources available. Does your organization offer EAP? One thing I will stress is that in many of the agencies that I've been out to speak at, especially in the HR world, one thing that I've shared, or one thing that I've noticed from agencies and I've shared with HR, is that sometimes when people are starting at a workplace, they meet with HR. HR does a great job at giving them everything that they need to start. But then there's no reminders along the way. We need to remember that when people start at an organization, they're given a lot of paperwork, they're overwhelmed, they have a lot on their plate. I think it's a good idea for HR to do check-ins with staff, even friendly reminders that, hey, guess what? We do have EAP and this is what they offer, to remind people that these services actually exist, and not only throw out EAP or offer an EAP phone number or card when someone's in distress. One thing that employees have shared with me over time is that a couple of things that consistently get mentioned is that they didn't even know their organization had an EAP program. They felt that their EAP program was not anonymous, and they felt that they again couldn't share, or they felt that they had to check in with their manager before they use their EAP services. So these three things are something to consider when you are communicating with your staff, and also looking into resources in your community. Now, having said that, I definitely want you to visit our website, cmha.ca. Like I mentioned, I work at the PL Dufferin branch. each branch, so if you go to the cmha.ca website, you can find your local branch at the top right of the website. And once you find your local branch, so if you're in Oakville, there's a Halton Region CMHA, you can check in with them and they have a list of resources and services in that local area. This is another free service that you could share with your employees. The next thing on here is validating employees' need for accommodation and to consider short-term and longer-term needs. So there may be things that they need right now, right? So right now might look like, and I'm just throwing out things here. It's going to look different for every person, but right now the employee might need a day or two off to sort a few things out. They may need to leave work early for a couple of doctor's appointments. That may be short term, but we also want to look at longer term. We want to build that relationship with our employee. We want our employee to stay with us, and we want them to be well. So working towards solutions, so collaborating on short-term goals. So again, a lot of organizations get into this, template of what, they do the same thing for each person. I think that we need to rethink this. So collaborating on short-term goals, this is where we're asking the employee how they're feeling, how they're doing, how you can help, and actually brainstorm with them. Have a conversation of what can be done. Again, we want to stay away from advice giving, especially right from the get-go, because right in the beginning, we want to show them that we're with them, that we're present, that we are listening. And once we do some validating and paraphrasing, then we can sit down and brainstorm what are some short-term goals, what they'd like to see happen, what you can do, what you cannot do. Maybe you have some follow-ups to make, appointments to make, etc. Having said that, we want to set a check-in schedule. So when, where, and how often. I think this is a brilliant idea. So at my workplace, even before or if someone has an issue, we have regular check-ins with our managers, which I think is a great idea. And we start off the conversation the same way. How are you? Very simple question. When you're having these regular check-ins with your managers, with your supervisors, this is preventative. It's preventative maintenance. You are checking in with your employees on a regular basis. You're not just checking in with them when things are rough or things are bad for them, right? Having said that, the same goes when you're accommodating someone. So you accommodate someone, you set a schedule, you have an idea, you have a plan, that's great. But once that plan is set and in place, we still need to continue to do check-ins. Having said that, we need to recognize that accommodation is not a straight line. Again, it's not the same thing for every person. We are all very different. So keeping that in mind, we want to review it regularly. We want to be flexible. And also, you want to have documentation. So when you are meeting with your employee, you are making notes, you are keeping track of the things that you're doing and the things that they're doing as well. Just so you have documentation if you ever need to refer back to it. Recognizing progress made, I think, is really awesome. Recognizing challenges that still need to be overcome. So keeping track of that, having conversations of things that are going well, and maybe some things aren't going so well and you need to change that accommodation again. You may have to accommodate or change your accommodation a few times before you get it right. And maintaining that trust. And I'll tell you this, maintaining trust is a big deal. And I do say this because I have been in situations where people have shared, or I have shared with someone to find out that other people know about it. This is something we definitely want to stay away from. Sharing other people's stuff. So getting an employee back on track, again, this is not I'm going to say this is not easy, for a lack of a better term right now, because everyone is so different. So we want to agree on an action plan, what needs to be done, what can be done, and what accommodations can be done if necessary. So like I mentioned, with certain accommodations, some companies can resort to the undue hardship based on the accommodation that's required. Again, when we are in that situation, I would refer to your HR specialists who would have all of the paperwork, all of the legal stuff that you need. Providing resources, so you definitely can use CMHA as a resource. If you check in with your local branch, you can also find out resources available. I will share with you later on 2 free resources that I think all of you can share with your employees today. One of the resources is called the Big White Wall, and the next one is called Bounce Back. These are 2 free peer support run websites that have online conversations, online videos, online chats, and online peer support to support individuals living with anxiety and depression. For one of them, you need a referral from a doctor, and for the other one, you could just log in, and if you're in Ontario, the service is free. We've so far heard great reviews. I've checked both of them out myself, and it's pretty neat. So I will put those up at the end of this workshop. Creating opportunities to stay in touch. So if someone is taking time off, how can you stay in touch? So again, having that conversation, adjusting timelines and expectations as necessary. So remember, if someone is struggling per se, they may need some more time to finish up a project. So maybe you need to bring in some other team members or someone that can help. Focusing on positive specific feedback. You know, employees already have a hard enough time coming to you to share, especially their mental health concerns. Yes, we may recognize some negative things that are happening in the workplace, like not meeting a deadline, like not showing up to work on time. They're all negative, and I understand and appreciate that they have to be addressed. But when someone is doing well, we also want to let them know that as well. The last one I already mentioned is keeping issues confidential. This is so important. So when we're talking about colleagues, because whether or not you're a supervisor or a manager, you may have a friend in your workplace. So whether it's a friend or an employee, just some tips on how to help when you're having a conversation. I already mentioned listening and how important that is. You may be taking a workshop on mental health, and you may know some stuff, but it's not going to be your job to diagnose anyone, right? This is where we're not throwing out lines like, I think you have depression, or I think you have anxiety, right? It's not your role to diagnose individuals. If you recognize that someone is experiencing certain symptoms, we want to recommend that they get some help, that they go and see their doctor, that they have a mental health assessment. Not making it about you. So again, if you're a supervisor or a manager, yes, you need to get the job done. Yes, you have targets, you have numbers to make, but the conversation is about the individual and not you and your targets and what's going to happen to you. Asking open-ended questions. So we're hoping for questions that are going to perhaps guide the person, not asking questions that are yes, no answers, because we're hoping for this individual to open up to us, right? Asking how you can help. I've mentioned that. You may, depending on the person, the situation, offer to look into or research an issue. So maybe you're going online together to look things up. Maybe you're going online to look up a doctor. I'm not sure, but I would do that with the person as well. Organizing a wellness program. So we have one here in our workplace, and it's a group of volunteer employees that we change the individuals every year. And this wellness program is set up to enhance the wellness, the mental wellness of our employees here. And essentially what they do during the year is they set up events or they set up workshops, anything that they think that the staff would appreciate. Lunch and learns, yoga, massages at desks, even just opportunities for everyone to get together and chat. They organize these wellness events throughout the calendar year, and then next year new people come on, new ideas, etc. Supporting efforts to get help. So if your employee, if your colleague or friend is getting help, doing some check-ins, check in. Have you called? Have you made an appointment? Do you need my assistance? And also at the same time, remembering that you need to set boundaries yourself. Oftentimes we can get very wrapped up in helping other individuals that we forget about ourselves. And as a manager, as a supervisor, also as an HR representative, you are hearing a lot of things. You are hearing people's problems, issues, things that frustrate them. And that, although you may not think it does, it affects you, right? It may affect your mood. It may affect the way that you sleep. It may affect the way that you think of individuals. So what we need to do and remember is to set boundaries. When can someone contact you? Can someone connect with you in the evening? There's things that you can do. There's things that you cannot do. And having said that, self-care is super important. Excuse me. So some more things to keep in mind when we're looking at accommodation is that we need to remember that it's not, or it may not be easily identified. So sometimes it's very straightforward and simple, but sometimes we do need to have further conversations to find out what this individual needs and how we can help them. Only those who need to provide the accommodation need to know. This is super important. So you have one employee, you have 7 managers in the workplace. All 7 managers don't need to know about the accommodation. Only the manager that is supporting that individual and that is going to be involved in the accommodation. So essentially, if someone's being accommodated, the entire workforce doesn't need a memo sent out that so-and-so is being accommodated. There is a right to request assistance. This comes from the employee. So your employee may request for you to help them out. And also being prepared for regular monitoring. When we're looking at management, we want to take notes on the accommodation requirements, using a doctor who can assist you in defining what you can do, what you cannot do. So some individuals may need to go and see their doctor, and they may be able to share with you some more information, and a doctor may give you that information that you need. It's not going to happen every time, but if and when it can, you can use that to help you accommodate the person. Timelines are also helpful in terms of assessing their progress, assessing whether or not you need to readjust as well. Some workplace resources to think of and also to keep in mind or consider. We have human resources, so we want our staff to feel that they can go to HR at any time to look for a resource, to talk, to ask questions. That open door policy, I think, is a great one where someone can just walk in. Same thing with colleagues, supervisors, managers. We want our employees to feel like they can come and talk to us at any time. They don't need necessarily a scheduled meeting to come and see you. And I realize and appreciate that we're all busy and we're all doing things, and someone may have to set up an appointment to see you. But overall, we want people to feel to feel like they are welcome to share. I mentioned wellness committees. That's something to think about if you don't have one in the workplace. consider starting one up, your EAP providers. And also, something that I noticed in doing the workshops in the community is oftentimes employees have benefits, they're not using them, they don't know much about them. So when we talk about these friendly reminders, that's also something to consider. Remind people that they do have benefits. They can go and get a massage, they can go and see a dentist, these sorts of things. I've also listed some accommodation resources. So these are websites where you can visit to get some more resources on accommodation, information about accommodation. So we have HR lawyers. These individuals we use, Lauren Bernardi and her team. We have the Ontario Human Rights Commission, Mental Health Commission of Canada, Workplace Strategies for Mental Health, and Mental Health Works. Now, I'm going to pull up a resource that I want you to have. Here we go. Okay, so these are the two free programs. Now, if you, what I'll do is I will email Shalini this, and she can send it out. It looks like there's 74 of you online, so I'm sure Shalini has your email addresses. I will email this to Shalini, and then she can email it to you. And please feel free to use this, to print this off and give this out, or email this, distribute this to all of your staff. This is these are two awesome resources, and like I said, they are free. So you may have someone who is struggling with mild to moderate depression. This is something that they can start with. You may have someone, for example, who's on a wait list to see a doctor, a psychologist. They're looking for a referral, these sorts of things. These are tools that they can use while they're waiting, right? Especially the big white wall, because there's no referral. And if you take a look here, there's anonymous peer support, there's self-guided courses, self-improvement tools, assessments. There's all sorts of things that they can access through these free services. So I will email this to Shalini after we're done. So having said that, I'm going to put up my information, and then Shalini can send me some. If anyone has any questions, you can send them my way. I'll put up my email address and phone number if any of you would like to connect with me about getting further information, further training. This was a very brief. We only have 1 hour, but it's a brief Coles Notes version about accommodation. We do have further trainings on psychological health and safety, and developing a plan for your workplace. If that's something you're interested in, you can connect with me. I'm just going to pull up my email, phone number, all that stuff, and you will have my information. So if you have any questions, you can send them to Shalini. Shalini has mentioned that quite a few people would like the slide deck provided. No problem. I'll email my slide deck to Shalini so that you can have a copy. And if you have any specific questions about what we talked about in the slides, then you can also send me an email. In terms of here we go. All right. So this is my information. There's my email address there, my phone number, and my extension. This is the location that the Peel Dufferin branch is out of. And are there any questions?
Yeah, hi, Tammy. Thank you so much for an amazing presentation. We do have some questions, and in order of priority in the sequence we got. I think we have to recognize a lot of what you've said is it's very good for an employee who perhaps is having mental health issues to be able to go to the HR department to discuss. But we do recognize a lot of the attendees today enterprise and they do not in fact have an HR department. I have a question here which says, what happens in a family business environment where there is no HR? Then whom do we report this to?
Okay, so if there is no HR and you are the owner, whoever the employee reports to, it doesn't have to be HR. If it's a two-man show, then one person is going to be speaking to the other and vice versa. If it's a small business, you're reporting to whoever they normally report to.
Okay, thank you. We also have another question. What should you do if the questions to support individuals are uncomfortable for ourselves or the manager? They seem quite personal, and some people just aren't comfortable with intimate conversations like that.
No, and you're 100% correct. It is uncomfortable, and it can be, and they don't necessarily have to be that personal, depending on what they share with you. If in this situation, when you are having a conversation, it involves their mental well-being. I mean, let's be honest, it could be anything that this person is dealing with. They could be going through a divorce. They can be going through a custody battle. They could be new to the country and adjusting. There's so many reasons why someone's mental well-being is not well. And like I mentioned earlier, just because someone is having some mental health struggles right now doesn't necessarily mean that they have an illness per se, and that it's going to be something that's with them long term. So in terms of having a difficult conversation, I can agree that these conversations can be difficult. But I also want you to remember that your staff, they're working for you. Hopefully they're working hard for you. We want to show them that respect and that care, and you're only going to show them that by having these difficult conversations. If you have somebody else in your organization that you feel that could help or would be better or more useful per se than yourself, then maybe you can have that conversation with the employee if you can bring somebody else in, and also asking permission, right? Is it okay to talk about X? Would you like to talk about X? That's the only advice I could give at this point.
So I'm going to ask the next question, which is very similar to what you've already covered. We have someone who said we are a small office and all work very closely. How do we handle the confidentiality of issues the staff member is having so that our management teams can support the employee? I believe you might have answered this already. I don't know if you want to add anything else to this.
Yeah, so that's a great question, and I have worked in large offices and I've worked in small offices, so I can appreciate the small office, very maybe small space even. Everyone is close to each other, everyone knows each other's business per se. However, simple things like going for a walk, closing your door, not sharing people's information, especially if it's personal. You may be a small office, but not everyone needs to know what's going on. I have worked in offices where, executive directors are sharing information about what somebody's going through. That's unacceptable, right? Same with HR. Being a small business, there could be 3 of you. The conversation doesn't have to be between all 3. It could be just between 2 people and leave it at that. Now, the tricky part there is when we are accommodating someone, sometimes other people recognize that, and this is where you may receive a complaint. So and so's getting accommodated. Why are they being accommodated and not me, et cetera, et cetera. And this is where we need to remind people that essentially it's none of their business. I wouldn't say it as rudely as that, but essentially it is none of their business. This is not something that you need to or have to discuss with other employees, if that makes sense. I hope that makes sense.
One last question. What if you check in with the employee about change in behavior and performance multiple times, but the employee refuses to cooperate or share what is going on? How would
Okay.
you suggest to how would you suggest to proceed if no
Yeah.
improvement is made?
Right. Okay. So that's a great question. So I'm checking in once, twice, three times. The employee's telling me nothing's wrong, nothing's wrong, nothing's wrong. But you notice that whatever it is that's happening is it affecting their work, then you're going to have that conversation about their work. So if you're trying to be open about their needs, perhaps their mental wellness, and that conversation is not happening, then I would turn the conversation and talk about things that are not getting done, and how you're going to work towards fixing that. So emails, phone calls, deadlines. If these are things that need to be brought up, then they need to be brought up, and you need to have that conversation.
Thank you, Tammy. So there's one last question. The question is, can Tammy do online sessions like this for employees or managers? And I know the answer is yes. If you could kindly elaborate a little bit more so everyone else can get the answer as well.
The answer is absolutely. I will, Shalina, are you okay with sending everyone the list of workshops that we offer?
Absolutely, I can do that for you.
So I'll tell you a little bit about what I do and my team does. We actually go out to organizations and we run mental health training. So we can come out and do a lunch and learn, that's an hour, but then we can also spend a day with your employees, with your managers and supervisors, and talk about mental health related topics. We have all sorts of different workshops available, from dealing with stress to mental health first aid. We also have one that's called Mental Health 101 that's very popular, where we talk about awareness and stigma, resources, how to get help. So I will send this to Shalini, and again, you can connect with me. My information's up there. You can connect with me directly. So we can come out to you, or we could, if you have access to the online platform, we can definitely do webinars as well.
Can I also add there, I recognize that some of the sessions you do are longer, and I know there's not a huge cost attached to it, but there's a small cost. Recognizing that a lot of the organizations today are small, medium enterprise, the Peel Halton Workforce Development Group would be happy to collaborate a workshop for maybe 3 or 4 employers who want to pool their resources and have you come do a whole day or a session for their team. We would be happy to be the organization that can, if there's a few smaller employers interested, we would be happy to collaborate and work that out for you.
Yeah, that's a good idea. That would work out as well, especially for the smaller agencies that may have 2 or 3 people working there. If you can get a few smaller organizations together so that you have 10 to 20 people, then yeah, we can get everyone together and host a workshop for sure.
So I've just been asked a question if the recording link would be shared with everyone. I just want to let everyone know we will be sharing the slide deck, the resources as well that Tammy just talked about, Bounce Back, and as well we will be sharing a link to the recording, which will be placed on our website for everyone's reference in the future. With this, I just want to thank everyone. This is all the time we have for our webinar today. We ask that you take just a few minutes to answer today's exit survey questions and let us know where we can improve and what topics would be of interest for you in the future. For more local, relevant, and timely labor market information, please also visit our website, which is workinginpeelhalton.com. On behalf of myself, Tammy, and the entire team at the Peel Halton Lepke, thank you so much for joining us and taking the time to view our presentation. I'd also like to say in closing that stay tuned for our next webinar, which would be around HR issues and the new changes with the Employment Standards Act. It was last hour with you. Have a great day. Thank you very much.
Thank you.